Welcome to today Mac Talk podcast. My name is Majok Woodchuck. I am Hepatitis B ambassador, and I would like to talk about on the consequences of hepatitis B. What is it, and what sort of disease that come with it? Thank you so much for joining us. Good afternoon. Today we are going to talk about the community public health awareness. And in this topic today will be our liver organs and hepatitis B, the disease that affect the liver. And what is the liver and hepatitis B? How does hepatitis B affect you? Who has hepatitis B? How do you get hepatitis B? And so forth. There will be a lot of topics that I will cover in this journey. So just follow me here, just keep on listening as we go ahead. So the first one we'll need to look at is the hepatitis B. And what is the liver? The liver is the largest organ in the body. A healthy liver cleans the blood, fight off infections, help to break down foods and nutrients, and it stores our vitamins. Hepatitis B is a virus that is too small to see, but can cause serious sickness in the liver and the body. Hepatitis B is a serious disease. How does hepatitis B affect you? The hepatitis B virus can make the liver inflamed and scarred, and then the liver cannot do its job very well to keep you healthy. Most people with hepatitis B do not feel sick until the disease is very advanced. They have no symptoms. People may start to feel sick, tired, have pains and fever when the liver is very inflamed and scared. Most people get hepatitis B as a baby or a young child, and they have the virus for life. This is called chronic hepatitis B. The virus can slip and cause no real health problem for a long time, but the virus can wake up in some people and make them very sick. Of every 4 people who have chronic hepatitis B, 1 will get liver scarring, known as the cirrhosis, liver cancer, or liver failure, and become very sick if they do not get treatment. Check up at the doctor every 6 months will help to prevent this disease. Poor people out of them get a really bad sickness. Who has chronic hepatitis B? Many countries have large numbers of people who live with a chronic hepatitis B. Men and women born in Asia, the Pacific Islands, Africa, the Caribbean, Southern European, the Middle Eastern are more likely to live with hepatitis B. The Aboriginal people and the Torres Strait Islander people also have a high rate of hepatitis B. This is the same notes that can be really found out in the South Sudanese community. People live with a lot of hepatitis B, but are noticed, and later on people just die without knowing what has killed them. Hepatitis B is often found in several people in the same family. Most people get hepatitis B when they are a baby or a young child. If you have hepatitis B, it is important that your brothers, your sisters, your parents, your partner, and your children are tested to see if they have the hepatitis B virus. How do you get hepatitis B? This is the most fundamental question a lot of people ask all the time. The hepatitis B virus is carried in the blood and sexual fluids. Most people get hepatitis B when they are born or very young. Babies can get hepatitis B at birth if the mother has hepatitis B. If you know the mother has hepatitis B, checkups and medicines during pregnancy can protect the newborn baby from getting the virus. You may also get it from someone who has the hepatitis B by sharing blood stain, by sharing needles and equipment for tattoos, piercings, injecting drugs, contact with the blood or the source of an infected person, sharing razor blades, toothbrushes, nail clippers, earrings, and also having sex without a condom can cause hepatitis B. One thing that you need to know and to get it right is that you do not get hepatitis B from mosquitoes, sharing foods, drinks, and sharing cigarettes. You cannot get hepatitis B from breastfeeding, touching, kissing, and hugging. Coughing and sneezing doesn't cause hepatitis B spread. Sharing plates, cups, forks, spoons, and Chopsticks do not cause hepatitis B. Sex using condom is safe. You cannot get hepatitis B from that unless if the condom is broken. How do you check? So to test to check for hepatitis B. Of every 2 people who have chronic hepatitis B, 1 does not know they have it. You can either ask your doctor or any nurse for a simple hepatitis B blood test to check. The result of the test will come back to the doctor, and then this test will show if you have a chronic hepatitis B virus, if you are protected because you had the hepatitis B vaccinations, or if you need to have hepatitis B vaccination. The doctor will recommend all those resources to you. You need to check up every time so that the hepatitis B can be monitored. The hepatitis B virus in your liver changes over time. It changes so many times. It doesn't stay stagnant there. Checkups every 6 months are very important and they are encouraged. You tell the doctor about any damage in your liver, and this could be told by the results you get from the testing. This means having a blood test and maybe ultrasound or scans can show any good image on how your liver is damaged. The test result will tell the doctor if you need to start taking medicines. Most people with chronic hepatitis B do not need to take tablets as the virus is sleeping and is not causing damage to the liver. The doctor may ask you to see a special hepatitis B doctor. So blood tests in every 6 months to monitor your sleeping virus is recommended. Also ultrasounds or any scans that see the liver is also recommended after 6 months. The treatment and medicines for hepatitis B. You may need to take tablets in the future if the virus wakes up from sleep and it starts to damage your liver. You will need to take these tablets every day to help prevent the liver damage and liver cancer. These medicines do not cure hepatitis B. Hepatitis B do not have a cure. It will not make the virus go away, but it does help to reduce the damage to your liver and liver cancer. It helps to keep the virus under control. It is important to continue to have a regular checkup after every 6 months. It is important. Stay healthy and well. The things help you to be healthy. It's a variety of foods. Eat fruits, a variety of vegetables, rice, grains, and nuts, fish. Be healthy body. You need to reduce weight, not gaining weight. Exercise and keep active. You need to try to keep walking with family and friends. Try to play some sort of sports. Get checkup every 6 months. Get vaccination for hepatitis A. Avoid drinking alcohol and taking drugs, as these are the major contributors to liver failure, causing cirrhosis. Stop smoking cigarettes. Do not smoke, and this also could contribute to your liver problems. Do not eat much takeaway foods, chips, sweets, processed meats, cakes or sweet drinks. All this can contribute to the damage of your liver. Having a baby. All newborn babies in Australia are offered a free course of 4 hepatitis B vaccinations. These injections usually stop children from getting hepatitis B. If a pregnant woman has hepatitis B, she needs to have a special checkup. She may need to take medicines in the last month of pregnancy to stop the baby getting the virus during the birth. The babies of mothers living with chronic hepatitis B are always given an extra injection soon after birth. This will stop most babies from getting the hepatitis B virus. The mother and the baby then need to have a regular checkup for many years to come. Hepatitis B is dangerous to most families. Caring for your family, preventing hepatitis B. Hepatitis B vaccination is the best way for your family and those close to you to be protected against hepatitis B virus. Remember that the hepatitis B is often found in several people in the same family unit. If you have chronic hepatitis B, it is important that your brothers, sisters, parents, wife, husband, sexual partner, children are tested to find out if they have hepatitis B. If they have not got hepatitis B virus, they can get free course of hepatitis B vaccination. It is important to check the family members sharing a house with you to know about the vaccination to protect them. Remember to take care of any family member that have hepatitis B. Vaccination is the best way for your family, and this could protect you, clean up your blood, and cover open wounds. These are the most important hygiene that you need to practice in your family. Do not share rubber blades, do not share toothbrushes, do not share nail clippers, or do not share earrings. Do not share piercings, materials, or injecting drugs. Use condom when having sex with a new partner or having a checkup to find out if the person you're having sex with have hepatitis B. This is very important to keep the family safe from the virus. Hepatitis B can cause huge damage and give people a lot of anxieties. Living with chronic hepatitis B, what does it mean for you? Some people want to tell friends and family that they have a chronic hepatitis B. Other people may feel ashamed and worried. They do not want to talk about hepatitis B. It can be helpful to talk to people who understand you, especially the health practitioners, the counselors. Take time to decide who you can trust. It is important to think about telling people in your house and your sexual partners so they can be tested and get vaccinations. This could be helpful to talk about this with your doctor. Remember, vaccination can protect so they do not get hepatitis B. Chronic hepatitis B can cause liver and disease and liver cancer. Ask your doctor for blood tests to check if you have hepatitis B. Treatment for hepatitis B reduces the chance of liver damage and cancer. Medicines work well and are easy to take. Get a checkup at the doctor every 6 months if you have a chronic hepatitis B. This is important to help your body function and get help out. Thank you for today's episodes, and I hope this can help out our community to get people tested and to get vaccines wherever possible. Thank you for listening. My name is Majok Woodchuck.